Hello, my name is Seth Oliveira. I'm the Director of Functional Neurosurgery at the Providence Brain and Spine Institute. I also work for the Oregon Clinic Neurosurgery and Spine. This video is designed to educate you on the procedure called deep brain stimulation and what you can expect before, during, and after surgery. We will, of course, discuss all of this in further detail during your in-person appointment. To begin, let's talk about the procedure. Deep brain stimulation, or DBS, is an FDA-approved surgical procedure for several different neurologic disorders, including Parkinson's disease, essential tremor, dystonia, and epilepsy. Deep brain stimulation is non-ablative, meaning that it's intended to alter the activity of the malfunctioning brain circuitry. Because DBS does not damage the brain, it is adjustable and reversible. It does, however, require an implantable device, which we'll talk about in more detail later. In contrast, an ablative procedure like focused ultrasound intentionally burns these areas to create a beneficial lesion. While these procedures do not require an implant, the effects are fixed and irreversible. It is important to note that deep brain stimulation is not considered curative. Many of the movement disorders we treat with DBS have a progressive nature, and they often continue to progress despite intervention. Despite this, DBS can be very beneficial for many of the symptoms. Generally, DBS is not considered a first-line treatment and is only recommended for patients whose conditions are not helped by medication alone. Deep brain stimulation can create a dramatic improvement in your quality of life. It is, however, one of the few elective brain surgeries, so the risks must be carefully considered. There are 3 types of risks with DBS surgery. The most common risk is infection at the incision sites. A superficial infection can very quickly spread to the implanted device and hardware, so we must be very cautious and protective of the incisions. The second risk is related to the electrical stimulation from the implanted device. Patients may experience tingling, numbness, muscle contraction, worsening balance, and speech or mood problems. Most of these issues are transient and reversible and can be addressed by adjusting the settings on the implant in clinic or in some cases over the phone. The third risk category involves serious complications such as brain hemorrhage, stroke, seizure, or brain infection. Thankfully, these serious complications are exceedingly rare, occurring less than 1% of the time. Thank you for joining me for this overview of deep brain stimulation. Again, all this will be discussed in further detail during your in-person appointment. We'll be happy to answer any questions that you might have.